Hello guys, welcome to our very first video of anatomy where we will be discussing the intro to anatomy in the most simple manner. So sit back, grab your popcorn and relax and enjoy the show. Of course, we do have an outline where we'll be discussing about the concept of anatomy, the approaches to studying anatomy, the body, its parts, the positions of the body, planes and terms. Without wasting time, we move to what anatomy is about. Anatomy is basically the study of structure. It's just as simple as that. So, anatomy is quite different from the course physiology, where you go about studying the functions of that structure that you studied in anatomy. So, anatomy forms the basis through which we can evaluate the course physiology. So, it's that important to pay attention in anatomy class. To study anatomy effectively, we use two main approaches, which are the regional and the systemic approach. So, what is the regional approach? The regional approach is the approach in anatomy where we consider parts at once. For example, we have the arm, the forearm, all those parts. We study everything within that part at the same time. That is basically what the regional approach is about. The body is segmented into various parts such as the head, the neck, the thorax, the abdomen, we have the upper limb, the lower limb, we have the pelvis and perineum. So those are basically the parts of the body when viewed through the regional approach. It would be illegal if it got any simpler than that. Next, we have the systemic approach, where we consider the body as a unit made up of collaborations of different uh, systems that function together to form one unit. So we don't consider this digestive system together with the excretory system, whether they fall into the same location or not. So that's basically the systemic approach. So, for example, we can take the digestive system where we have the mouth as the first part, then we can go to the esophagus, but before that, actually, we have the pharynx, and then from the pharynx, we can move straight up to the stomach, and then from the stomach, we can move to the intestines and the anus. Next up, we have body positions in anatomy. Body positions are about five in number. So the body positions are the anatomical, fundamental, the prone position, the supine position, and the lithotomy position, coming in as last but not least. There are also others. So for the anatomical position, the body is erect, the eyes are looking forward, the palms they face forward, the fingers are pointed down, the lower limbs are parallel to each other, and the toes point forward. It's just a position where the person is kind of stiff, trying to be as erect as possible. So that's basically how the anatomical position is. You see the image right now. The anatomical position image is looking as you're seeing it on your screen. It's the person just looks kind of stiff. Next up, we have the fundamental position, which is basically the same thing as the anatomical position, but the palms are just kept on the sides of the body. So if you look at the image on your screen, you see that the hands are not directed laterally as in the anatomical position. That's the basic difference between both of them. It's in the hands. So unlike the anatomical position, that's like a soldier that's kept at maximum tension, the fundamental position says otherwise. Now we have the supine position where the person is just laying on his back. So that's the supine position. And then we have the prone position where the person is laying on his chest. So then we have the lithotomy position, which is usually used in all pregnant women to perform tests and stuff, where the person's knees are kind of flexed and the person's thighs are abducted at the hip joint. So that's basically the description of the lithotomy position, and it's a position usually adopted by women and not men. It's just the basic description of lithotomy position. Next up, we have anatomical planes, which are just like sections through which the human body can be viewed properly for better understanding. That's like you can cut it at those positions. So that's what anatomical plane is. We have a few of them. For example, we have the mid sagittal plane, which goes through the direct center of the body and like divide the person into two equal right and left halves. That's the mid sagittal plane, right through the middle there. You can see it on your screen. The person is separated into his right and left halves completely through a midline. Yes, that's the mid sagittal plane. And then next we have the sagittal plane or parasagittal plane, where the person can be divided at any position that is parallel to the sagittal plane, to the mid sagittal plane. So the person can be divided at any of these locations, and as long as it's not going through the midline, that's the sagittal plane. It's right there on your screen. And next we have the coronal plane, where the person can be divided rather than into right and left portions. This time around, the person is divided into front and back portions through a vertical line still. And then we have the transverse plane, where the person can be divided at any position between his head and toe. So that's it's just like cutting a person at any location along a transverse line. So that's the transverse plane. And then we have the oblique plane, which is any plane that doesn't conform to any of the earlier four planes. It is a plane where the person can just be cut along any axis in order to study whatever you are trying to study in the body at that location. So that's basically all the anatomical planes that we have. Next up, we have the anatomical terms. I'm sure quite a lot of you have been waiting for this segment, perhaps that's even why you're watching this video. So let's move to them. We have first anterior and posterior, which are like anatomical terms to represent things that are ahead and things that are behind. So anterior represents whatever lies in front, while posterior represents what lies at the back, as you can see in your image on the screen. Then we have ventral and dorsal, which are used to represent also similar things to anterior and posterior. It's where ventral is similar to anterior and dorsal is similar to posterior. It's also on your screen. You can see it. Then next term we have superior and inferior. Superior is used to represent whatever lies upper than something else. So whatever is upper is superior, while whatever is lower is inferior. You also know about superiority and inferiority complex. So superiority is higher, inferiority is lower. We have central and peripheral, where central is used to denote something that lies in a center position, a central position, something that's like in the middle, while peripheral is something outside the middle. Then we have median, medial, intermediate, and lateral, where median is used to represent something in the midline, that is something along the mid sagittal plane, just as you can see in the screen. For example, you can see that blue and red small images in the center of the diagram. They occupy a median position in the diagram. Next, we have medial, which means something that's closer to the median position. For example, that purple tissue that you can see on your screen, it's medial in position. Then next we have lateral, which means far. That is something that's far from the median plane, farther than even medial. So that's basically what lateral is. And then we have intermediate, which is between medial and lateral. So those are the four terms: median, medial, lateral, and intermediate. Next we have external and internal, which represent outside and inside. Of course, I'm sure you already know that. Then next we have superficial and deep, which is used to represent what superficial being something at the surface, and deep for something that is goes more internal than the surface. So that's superficial and deep in your diagram. Then we have cranial and rostral, which mean the same thing, which are used to denote something that's closer to the head region, while caudal being something that is used when something is closer to the tail region. So as you can see in your diagram on the screen, cranial is closer to the head and caudal is closer to the tail region, which is around the hip. So that is that. We have ipsilateral and contralateral, where ipsilateral is used to represent same side. So if I say your right hand and the ipsilateral leg, I mean your right hand and your right leg. If I say contralateral, your right hand and your contralateral leg, I mean your right hand and your left leg. So that's basically what ipsilateral and contralateral mean. Ipsilateral, same side; contralateral, opposite side. So that's what the term means. Next up, we have the proximal and distal, which is used when we are referring to limbs. Proximal being something that is closer, and distal something that is much farther, and sometimes intermediate, something in the middle. So proximal is used to represent the limb, that is the portion of the limb that is closer to the chest region. So proximal is usually used, for example, in the upper limb, the arm is proximal, the forearm is intermediate, and the hands, that is distal. Next up, we have flexion and extension, where flexion is to move a portion of the body, that's a limb, from a straightened position into a bent position. That is, from its most relaxed position, you move it away and you bend it. So in extension, the limb is straightened and it's kind of like in its most relaxed position. Then next up, we have abduction and adduction. In abduction, the part of the body, that is the limb, is moved away from the body, and in adduction, that part is approximated towards the body. So abduction is to steal away, like you literally steal something away in abduction. Then in adduction, you move it towards. Next up, we have rotation and circumduction, where we have two types of rotation: medial and lateral. Where medial rotation is to bend something towards the body, while lateral is away from the body, as seen in the diagram. Then we have circumduction, where you just rotate it around. Then we have pronation and supination, where pronate is to face something downwards and supination is to face it upwards. The priest pronates, that's like the priest to bless his followers, he pronates his hand, while in supination you face that palm upwards. For example, that's if you're using your hand. Next, we have inversion and eversion, where in inversion something bends towards the median plane, while in eversion it bends away from the median plane. Then next, we have protraction and retraction, where in protraction something moves forward, and in retraction it moves backward. So you protract to punch someone and you draw it back with retraction. Finally, we have elevation and depression, where in elevation something moves up and in depression it moves down. That's how simple these anatomical terms are. Please do not confuse the terms with one another and use them appropriately. Thanks for watching. Please try to like and subscribe before leaving the channel. Thank you very much and have a very nice day from Hood Anatomy.